So if you're only missing one tooth, why a dental implant over a traditional bridge?
Yeah, well, a traditional bridge, the research shows that it lasts about 5 to 12 years. Okay, that's okay. We want something that's going to last a lifetime. The other thing is a traditional bridge, you have to grind down the two adjacent teeth just to put the bridge on. And then the bone underneath the area that's missing will actually go away over time. So we can maintain that bone, place a simple implant. I do everything with guided surgery, so it's very, very predictable. Also means that you're going to have less pain and less swelling. And then it stops the cascade, because what happens oftentimes is they'll get a bridge, and then something happens with the bridge. Maybe we have to take out another tooth. Then it becomes a bigger bridge. Then next thing you know, they're at a denture, and there are denture patients like we've been talking about.
So how long does a single dental implant last?
If it's taken care of very well by the patient and the doctor, it could last a lifetime.
So
just
they're
like a
considered
natural
permanent?
tooth.
Are they considered permanent?
It's like your third set of teeth. Okay, so you have your baby teeth, your adult teeth, and then if you lose those, you have your dental implant.
Now what about cost? I mean, the bridge is more, or the dental implant
They're
is
about
more?
the same price, but over time, it's actually going to save you money to do the dental implant because you're stopping that cascade of losing more and more teeth over time. So come see us for a dental
always
implant.
get a dental implant. Like if somebody in your family was missing one tooth, you would no way make a bridge for them.
No, for sure not. No. I mean, the dental implant is the standard of care now. This is the thing that every doctor should be doing.
But bridges are, well then if a dental implant for just one tooth is so good, why aren't they all doing it? I think they're just afraid of surgery?
I think people hear surgery, they think of an implant and think it's some big surgery. This is very routine. You can have it under local anesthesia. You can be sedated for it. Most of our patients take ibuprofen, Advil, 1 or 2 days, and that's it. It's not a big, giant surgery.